Mm-hmm. I know, I thought about it.
Okay, we're back. Yesterday, which is really, this was all one video, but yesterday we posted about the fact that my niece forgot that when she's on the pill, she is not ovulating because the pill, the patch, the ring, by and large, the most of them, the function is evening out your hormones, which stops ovulation, which causes birth control, lighter periods, shorter periods, eliminate your period, ideally less acne, less PMDD, premenstrual dysphoric disorder, which is PMS, a host of other good things. Now, are there side effects to the pill? Yes, of course, because you noted aptly that there are many, an influencer, I don't know why I'm saying influencer, they're influencers,
yeah,
but they're not doctors.
No.
They're not knowledgeable in the prescription of birth control.
Or in women's health.
Or in women's health, and that's not their fault. But,
no, and they don't claim to be.
But they use their platform, and this is my interpretation, in citing their own experience with the pill, be it a negative experience, typically, they extrapolate that experience may be the same for all women, and it is not. Just like as a physician, I might prescribe a pill to you, but I should and do say, here are the most common side effects. I cannot, nor do I, go through every single possible side effect. It would be impossible to do that and actually be a physician, right? But I try to go through the most obvious ones and why you may or may not want to stop the pill. And then also cite that, like, the pill is not for everyone. Some people love the pill and they need it, and other people hate the pill and don't need it, or it doesn't work for them even if they want it.
Yeah. I think the issue lies, and it's just the issue with social media in this day and age in general, is that even though these influencers might not be saying that they're a doctor or that they're an expert, they know that they have this, now inherent just influence, especially when it's all these young girls in their 20s and teenagers, younger, that are just kind of trusting these influencers with everything because they like them and they feel like they know them. And suddenly now, why is she saying that she had this really bad experience with the pill, or that she gained a lot of weight and her skin was this and she was really moody and cranky and just not feeling like herself? Like, maybe I shouldn't be on it either. And I joke that I'm like my little social world's like, I don't know, gynecologist, because everybody knows that my aunt is a gyno, so they come to me with all their questions, like I know anything. And I really have seen in just the last, year or so, friends coming to me and be like, well, I just feel like I should just get off the pill. Like, all these friends of mine, people I know, just having all these, like, newfound concerns about the pill. Even when they're not even, like, experiencing any symptoms, they just are like, well, I just think it's weird. I just feel like it's dangerous. Or I just feel like I've been on it for a really long time, and just sort of extrapolating from these influencers they follow's experiences. And influencers also don't give a lot of context. So they'll just be like, oh yeah, well, I had this bad experience, so I'm not on it. But they won't say, which not that they need to, or have to, but then just don't say anything at all.
Right. I think that you do have a big responsibility when you're on social media to make sure that you're very clear that when you're citing your experience, it's only your experience. And to your point, what many patients and followers and women and humans with ovaries now will say is, I feel like I should be off of it because I've heard that it's bad to be on it. I've heard that it can cause fertility issues. I've heard. And here's the truth. Is the pill perfect? No. Just like vaccines, they're not perfect. They are not for everyone. There will be fallout. There will be side effects, sometimes dangerous side effects from any intervention. But there will be side effects from lack of any intervention. For example, women who have dysmenorrhea, meaning really painful periods, women who have endometriosis, women who have persistent ovarian cysts, women who have PCOS. Some of them can be treated without the pill. There are other ways to treat these symptoms, but some of these women need the pill. Some women need it merely because they just don't want to be pregnant.
Yeah, I was going to say,
or they just don't want their period. And so, again, nothing is ever good and bad. There's good on both sides of the fence. I think as physicians, we should, and for the most part, the physicians I know are very metered about saying, here's the pill. If it works for you, it's great. And if it doesn't work for you, we're going to try other things. I think that many of the influencers are not as metered. They actually extrapolate and just make a blanket statement that the pill is bad. And that's a very dangerous precedent. And I've said this before, and I'll say it again. It's a very anti-feminist rhetoric. Without meaning to, these influencers, who are largely women, are actually shaming, blaming, and inciting feelings of like guilt and anxiety that women for years have taken the pill and now they feel like, oh my God, did I cause fertility issues? You didn't cause any infertility with the pill. I can tell you billions of women, and this is anecdotal and data driven, that have gotten pregnant immediately being off the pill. And similarly, I can tell you women who didn't get pregnant being off the pill, but their problem was not the pill. Their problem was whatever preceded putting them on the
That's
pill.
what they think, oh, it must be the pill.
Right.
But it's like we talked about intent versus impact.
Right.
These
And
influencers might not have a bad intention, of course, I would assume. But the impact is definitely far-reaching. And I definitely think that's something that doctors will have to deal with in the years to come.
Yes.
People trusting who they follow on social media more than their doctors.
Well, and I will also take culpability, not personally, but as as one of the medical community, where I do think that we haven't always done the best job, right? We're not always amazing at explaining everything. And I could cite reasons why, for example, our limitations with time. Like, we would love to have an hour with every patient, but then we couldn't run a practice because insurance will not cover reimbursements well enough for you to see one patient an hour. So in an interest to see patients and not have patients wait for too long and give the most salient, important pieces of information that they need, we don't go through all the side effects. And there has been a history of paternalistic behavior in medicine from men and women who are doctors, and in dismissing patients' feelings and complaints. That said, doctors don't go into this to harm people. And unfortunately, there is a lot of anti-doctor and anti-female rhetoric, I find, in social media. So that's what we wanted to talk about. But take home point. Do you ovulate when you're on the pill, patch, ring? The answer is largely no, you should not be ovulating. Is it okay to skip your period? The answer is yes, it is safe to skip your period. Is the pill, patch, ring for everybody? Of course not. Nothing is for everybody. But that doesn't mean it's bad for everybody either. So please be cautious in who you listen to. That's it.
Peace.
Bye.
Happy birthday to me.
Happy birthday to her. And I'll tell you after April 10th what I got her.
Oh, God.
Yeah.